The National Executive Committee of the Nigerian Association of Resident Doctors has wrapped up its two-day meeting in Abuja with far-reaching recommendations on how challenges facing better healthcare delivery in the country can be addressed. The communique, among others, called for the implementation of the National Health Act of 2014, noting that it is the bedrock for improving the Nigerian health sector. Presenting the communique, the president of the association, Aliu Sokumba, said the NEC meeting resolved to call on the federal government to declare the Lassa fever epidemic a national health emergency. It also observed that members of NAD in some states of the federation are being owed 14-month salary arrears and called on the government to see to the full payment of arrears to its members. The communique, while noting the poor working conditions in health facilities, as well as constant assaults on doctors while discharging their duties, called on the federal government to prioritize security of health workers.
NEC noted the failure of some chief medical directors and medical directors to implement the Medical Residency Training Act. NEC noted with dismay the insecurity across various states, particularly the federal highways in Nigeria. NEC noted with dismay the incessant cases of assault of her members at their working places in the country. Worthy of note is the recent attack on her member at Maitama District Hospital here in Abuja. NEC noted the stagnation and non-promotion of medical officers and residents in many health institutions. The association noted with dismay the undue sack of resident doctors in both state and federal tertiary hospitals without recourse to extant policies and guidelines governing medical residency training in Nigeria. NAD hereby calls on the federal government of Nigeria to make the issue of national security, and in particular, security of healthcare workers, a priority both in and outside the hospital all over the country. NAD calls on federal government to declare a national emergency on Lassa fever and also evaluate the hazard allowance paid to healthcare workers, considering the increased risk faced by healthcare workers. NAD enjoins the state government to capture funding of the medical residency training for residents in the state tertiary hospitals during their budget allocation. The association calls on the various state governments owing her members outstanding salaries arrears, especially state institutions like the EXUT, Lautech Oshogbo and Ogbomosho, Abia State University Teaching Hospital, Unimed TH, Kogi State Specialist Hospitals, to, as a matter of urgency, pay her members as soon as possible in order to guarantee harmonious working relationship in those states.
Fielding questions from reporters, the NAD president Aliu Sokumba also stated that stakeholders in the health sector are currently working to see that the coronavirus outbreak is checked and prevented from getting into the country. Sokumba also noted that the current extension of medicine study to 7 years before residency practice is being discussed in order to meet with the NUC.
If we have a state of emergency to improve the preparedness of our health institutions as well as their response in addressing the case of Lassa in our various institutions, we will go a long way in helping to curtail the case of Lassa fever outbreak in the country. Now that this coronavirus has been declared a public health emergency of international concern, it will be contained in no time, knowing the seriousness the World Health Organization put to ensuring that conditions declared public health emergency of international concern are contained in the shortest possible time period. I'm glad to inform you that at the moment, we are currently having negotiation going on between ourselves and other stakeholders to ensure that the controversies and misunderstandings surrounding the directives issued by the National University Commission is addressed among ourselves.
While calling on government to ensure that resident doctors who are due for promotion are promoted, NAD also commended the Gombe state government for prioritizing the welfare of doctors in the state and enjoined other states to do likewise. Rose Audu, reporting for Clearview Television.